I'm Richard Reilly. I'm Professor of Neural Engineering in Trinity College in the University of Dublin. And I work in the area of neural engineering, particularly clinical neural engineering, working with colleagues in hospitals around Dublin and internationally. And it's for this reason that I think this particular journal, the IEEE Journal of Translational Engineering in Health and Medicine, is particularly interesting. It's really important that we translate a lot of the research that we're doing in the laboratory or in the university setting into the clinic as rapidly as possible. And to be able to do that, we need to be able to describe what we're doing to colleagues, both in the clinical world as well as in the engineering world, and bringing those two areas together as much as possible. The IEEE Journal of Translational Engineering in Health and Medicine is an open access journal which allows engineering researchers and clinicians publish on new research which is coming from laboratories, but also from within hospitals, solving real issues of clinical importance. And I think one of the really important aspects here is that it's an open access journal. So anybody around the world can see up-to-the-minute research that's being carried out, which could have direct translation into the hospital, which could be a benefit for them or their healthcare system. Of course, to be able to do that, we need to be able to garnish and get together different researchers who are willing to publish in open access research journals. One of the big challenges, and in some ways a great disappointment about much of research which is carried out in the world today, is that we're often reinventing the wheel. But nowadays, many of the big funders, the NIH or European funding agencies or funding agencies around the world, are looking for people to publish in open access so that public funds are immediately accessible to everybody to be able to discern and disseminate research. Engineering, and particularly translational engineering in healthcare, covers a very wide area. So the scope of our journal is really looking at advanced engineering solutions which can impact or make a difference in healthcare. So we're encouraging people to submit articles which encompass all these different facets of translational engineering. The review process is critical. One of the most important aspects, of course, it should be fair and it should be transparent. So when new manuscripts are submitted by authors, they get reviewed by the editor-in-chief, and then they get sent and distributed to associate editors. And those associate editors then select particular reviewers with expertise to be able to critique those particular manuscripts. All manuscripts that are submitted are seen both by engineering reviewers, but also those clinicians and physicians working in the clinic to be able to really understand, is this paper that's being submitted really of significance that it's going to transform something important in healthcare? I think we have to set a relatively high bar for excellence of manuscripts submitted to be accepted and published in the journal. But also, I think we have to be honest also and say that we should have a rather high bar for rejection. We need to give innovation a chance here. So having two views from different perspectives, different disciplines, being able to critique a particular manuscript, I think is something very unique. And therefore, that's why the papers that are published in our journal have real importance for being translated into clinical practice. One of the big challenges nowadays is how to disseminate your research to be able to be read by a broad readership, but also to be taken up by both clinicians, but also by policymakers. And I think we have an opportunity with this journal to be a vehicle for scientists, biomedical engineers, and clinicians to publish and to disseminate to the widest possible audience. Consider publishing in the IEEE Journal of Translational Engineering in Health and Medicine.